Hello, I thought I'd introduce myself first. I'm Rachel Cutting and I'm the Director of Compliance and Information at the HFEA. The HFEA is a government regulator who makes sure fertility clinics comply with the law and treat patients safely. I joined the HFEA last November after working as an embryologist for 25 years. I worked in an NHS IVF unit and was a head embryologist and person responsible for many years. It is a role I'm incredibly proud to have had. Certainly has been a challenging start to my new role. In November, I certainly could not have predicted the events of the last few months. When the coronavirus emerged in March, the HFEA had to make changes to ensure we were doing the best for fertility patients, clinic staff and our own staff. We started working from home as it was no longer appropriate to be in our offices near Trafalgar Square. Fortunately, we have excellent IT support, so adapting to home working was very successful for us. And although we miss our daily interactions with our colleagues, we've worked well as a team over the last few months. Coronavirus has impacted on all aspects of our society, and the HFEA had to make very difficult decisions in March regarding fertility treatments. We closely monitored guidance from the medical and scientific experts in the UK fertility sector, as well as the government guidance. The advice from experts was that fertility treatment should stop. The HFEA authority met frequently and took the difficult decision to ask all clinics to confirm that no IVF treatments would continue after the 15th of April. This was not a decision that we took lightly, and we do acknowledge it had profound effects on fertility patients, but we had to consider many different factors whilst making this decision. First and foremost was our commitment to keep fertility patients safe, but also we had to protect the NHS from the impact of any fertility treatments, such as complications such as ovarian hyperstimulation syndrome, miscarriage and ectopic pregnancy. We took into account the decision to stop all non-elective NHS surgery and the restrictions on travel and social distancing. It was early into the pandemic and it was uncertain times. We regularly updated our social media accounts to give updates as and when we received them, and we also answered hundreds of patients' inquiries. We requested that clinics kept in contact with patients and that they could continue offering a counselling service. As the weeks progressed, it was clear as restrictions were easing that with guidance, clinics could open in a way which would keep patients and their staff safe. We made the decisions that clinics could apply to reopen after the 11th of May. We were one of the first sectors to reopen, which was announced by the Secretary of State. To be given approval to open, centres had to prove they had put every measure in place to be able to operate safely. They had to submit a treatment commencement strategy and complete a very detailed self-assessment questionnaire to show the HFEA what measures they had put in place to keep patients and staff safe. Clinic staff worked closely with their HFEA inspector to ensure the documentation they submitted was detailed and of sufficient quality to give the inspector confidence to allow the centre to reopen. It really was a stringent process. Some clinics were able to reopen quicker than others, and it depended on many factors such as the location of the clinic and whether staff had been redeployed elsewhere in the hospital or furloughed, and factors such as anaesthetist availability and whether appropriate PPE could be sourced. Over 90% of centres have now been approved to reopen and treatments are starting, although the number of treatments being carried out is lower than what we would normally expect. This is because centres are having to reduce the number of patients they can treat due to social distancing restrictions and having to space appointments out, for example giving hourly slots for embryo transfers rather than 30 minutes, so that they can thoroughly clean the room between procedures. The HFEA speaks regularly to clinic staff and we are reassured how seriously they have taken and put safe measures in place. Many centres are beginning, for example, with frozen embryo transfers and then prioritising patients for treatment. Each clinic will be working out how best to reopen safely. So I would encourage you to bear with your centre as they will be working hard to put their plans in place. During the pandemic, we haven't been able to physically visit clinics to carry out inspections, but we have been doing desk-based assessments to keep some regulatory oversight to ensure safe practices are being carried out. We are now thinking when and how we can start inspecting in the autumn. It is balancing the legal requirement for us to inspect, which also reassures patients that clinics are working to high standards and safely. But we also need to ensure that we don't increase the risk to clinic staff and patients to COVID-19. We are writing our own strategy to see how we can inspect clinics safely. Inspections may be carried out a little differently, but please be rest assured we will ensure our inspection methods will be as rigorous as usual. As some degree of normality returns, we will focus on what we believe is important for fertility patients. One aspect is to continue our commitment to provide information on treatment add-ons to help patients decide what treatment options are best for them. Add-ons are optional extras that may be offered on the top of fertility treatment, often at an extra cost. There are sometimes emerging techniques that have been shown some promising results in initial studies, or they have been around for a number of years but haven't necessarily been proven to improve pregnancy or birth rates. To make it easier to identify which add-ons have been shown to be effective, we've developed a traffic light system on our website to give information to whether these treatments will improve your chance of having a baby. We look at the highest standard of research available, called randomized controlled trials, to help make informed decision to whether a treatment should be classed as amber, i.e. there is some evidence that the treatment will improve the chances of her live birth, such as growing embryos in a time-lapse incubator, or red, where there is no evidence that the add-on is safe or effective. An example of this is reproductive immunology tests and treatments. This has been particularly controversial during the COVID-19 pandemic, as the treatments can involve using medicines which reduce your immune system and would therefore increase the risk of not only contracting coronavirus but also increase the risk of severe complications. The HFEA are clear that the use of immunosuppressants should not be used. There are many different choices to be made when having fertility treatments, and we would always recommend you discuss your individual situation with your doctor, nurse and embryologist. We can't offer individual medical advice, but we do produce and will continue to produce accurate and up-to-date information to help you through your fertility treatment. Thank you for listening, and don't forget to visit our website at hfea.gov.uk and follow our social media updates on Twitter and Facebook for further information. Thank you.